Everyone has a right to the highest attainable standard of health, but in many countries, far too many women, newborns, and children still die from preventable causes. Governments have committed to protect the health and well-being of all their people. They've promised to make sure that every woman can choose how many children to have and when to have them, that a skilled health professional is present at every birth, and that all children get the nutrition, vaccinations, and treatment they need to survive and thrive. People pay taxes so the government can provide these essential public services. A budget lays out how much money the government will spend and on what, and it reveals the government's real priorities. Citizens have a right to know how the government is spending their money so they can demand that the government keeps its promises. Budget information should be clear, easy to understand, and accessible to all of the people. Family Care International is mobilizing advocates from civil society, bringing together health professionals, religious leaders, community organizations, and advocates to call on governments to publish their budgets and make women's and children's health a top priority. In Burkina Faso, advocates discovered that information provided in the budget appeared vague, so citizens couldn't calculate the government's exact health investments. They could see that the government had committed far less than is needed to fulfill obligations. Advocates asked leaders to put more money into women and children's health, and the government agreed. In Kenya, advocates had trouble finding out when key spending decisions were being made and who was making them. FCI put together a calendar that clearly lays out the moments when advocates could influence critical budget decisions, and advocates are using it to hold government leaders accountable. In both Burkina Faso and Kenya, civil society advocates are working with allies in government to increase investments in the health and lives of women, newborns, and children. Learn more about the MACS project, the commitments that your government has made, and the ways that civil society can stand up for every woman, every newborn, and every child.